Today, I just want to talk about a condition that is very common in our setting, especially in surgical practice, where I practice. I work in a hospital in a general surgical department, so we meet a lot of general surgical cases whereby we have to operate. So we just want to talk about what most people call ulcers. But when you're in surgery, the ulcers or acids, they usually complicate in what we call a perforated duodenal ulcer or a perforated peptic ulcer. Because when you have an ulcer, in shona we are saying uneronda. So uneronda matumbu kana kuti uneronda mu stomach mudumbu chaimo chaimo. So when you have this wound of this ulcer can continue to get deeper. It can continue to ulcerate until the whole lumen of the stomach or of the small intestines. It's not the part that we call the duodenum. It could perforate, and all the substance that we find in the stomach or in the small intestines will leak into the abdomen, and that's a surgical emergency. So when people present with this peptic ulcer disease, it's usually on the background of drinking, smoking, and most people will report that they've always struggled with ulcers or acids, and most of them would actually be on treatment for acids. Some will tell you that I take MMT, I take ulcer gel, Gaviscon, some will be on omeprazole. So they usually present with acute onset of excruciating pain. That pain will just start out of nowhere. They will tell you that, Chiremba, I was previously well. Especially I went to bed. When I went to bed, I was okay. I was not in pain, and the pain was of sudden onset, and it was excruciating. And you know what? This pain usually starts in the early hours of the morning, around 12, midnight, around 1 or 2. So it's pain that actually wakes them up from their sleep. And when they present to us, they will tell you exactly when this pain started. Some will say, Chiremba, I just finished watching a Champions League match, and when I went to bed, as soon as I went to bed, this pain struck, and it was severe, excruciating pain in the tummy, especially in the upper parts of the abdomen, which we call the epigastric region. Some of them will vomit greenish material or coffee ground material, and the pain, remember I said it's initially severe and of acute onset. Sometimes it seems to be getting better until it starts to peak again, which is why sometimes these people may present late to hospital, maybe after a day or two. But this is a surgical emergency which needs to be operated as soon as possible before complications arise. Some of the symptoms will, in addition to the pain, to the vomiting, they may not be passing stool, and when we examine them, the abdomen will be tense.